Hey everyone, here we go again. Facebook Live Friday. Oh, I'm not live yet. Hey everyone, here we go again. Facebook Live Friday. Today we're going to talk about perineal stretching for childbirth. This is one that a lot of my clients ask me about, especially if they're under midwifery care. It's pretty common for midwives to prescribe this or recommend it during your last trimester. So we're going to talk a little bit about what it is, what are you actually stretching, what are you trying to do, and then what is a physical therapist or a pelvic floor physical therapist's perspective on the whole thing. So I'm going to run through a little bit of the evidence, the research behind it, what that research has shown us, and then what's my perspective as a pelvic PT and what I usually recommend. So it'll be a pretty quick one today. If you have any questions, feel free to plug them into the comments and we'll answer them as we go along. And then I'm still looking for a topic for next week. So if anyone has anything that they'd like to know about, anything pelvic floor related, prenatal, postpartum, fitness, or other physical therapy type things, back pain, hip pain, knee pain, there's nothing off limits. All right, so let's dive in. I'm going to check my little notes here. So perineal stretching, first thing you need to know is what's the perineum, right? So the perineum is that space kind of surrounding the vagina, between the vagina and the anus. And it's the most common place to have tear during a vaginal delivery. So perineal stretching is essentially a way that you're trying to prepare the perineum to stretch for the baby's head to come through. So the theory is that by stretching it for the month or so before delivery, you're going to improve the flexibility and elasticity of the tissue, try to prevent them from tearing or reduce the amount that they tear, the severity of the trauma. So, the evidence, there's not a lot, like with most women's health and pregnancy natural related techniques. There's not a ton of evidence. There was a Cochrane review done in 2006 and then redone in 2013. And if you're not familiar with evidence-based practice, Cochrane is, they kind of review all of the studies that have come out in the history of studying that condition, and they sort them by quality of evidence, whether they were high quality or low quality studies. They look at the results of the studies, how they were done, and then they kind of compile all of that into an overall statement about, what does the evidence really show us about whatever the topic is that you're looking at. So the Cochrane reviews that have been done, there wasn't much change between 2006 and 2013. There weren't a lot of studies. What they did show was that there does seem to be some benefit for perineal stretching for first-time mothers with vaginal births, if done in that last 4 to 5 weeks leading up to birth and between once and twice a week. So there was an effect seen for first-time birthing women for doing this technique. For second time, third time, fourth time, there wasn't really much benefit seen at all. The effect wasn't significant, except for with the outcome measures that they looked at, second time moms saw some benefit to the amount of perineal pain they had at 3 months postpartum. So there was some benefit to postnatal pain, but not necessarily to perineal trauma, to the degree of tearing or any other measures that they looked at. But for first-time birthing mothers, there was a benefit to reduction in episiotomy. There were fewer episiotomies with women who did perineal stretching. But again, they didn't really see much effect on any of the other measures that they looked at, which were things like incontinence, pain with intercourse, and other functional types of impairments, as well as the degree of the tear. So again, we have to take all of that evidence and say, well, there isn't a lot. There haven't been a lot of studies. There definitely haven't been a lot of high quality studies, and research is a funny thing. So you can manipulate a lot of different factors, and there can be a lot of confounding factors in research. But at this point, the evidence suggests that there's probably a benefit for first-time vaginal birth mothers in terms of reducing the risk of episiotomy and potentially reducing the risk for perineal trauma and more severe perineal trauma, and for pain months afterwards, months after birth. So there is potentially some benefit, and there's really not much risk. So in all of the studies, there were only a couple instances of, actually, no, in the Cochrane Review, I don't think that there was really really no risk that I recall. No huge negatives to perineal stretching. So it's low risk. Whether you get benefit from it or not, who knows? But if there's not much risk, then it's worth a shot, right? So that's kind of where the evidence stands on it. So that being said, the best results seem to be with performing it once to twice a week, so 1.5 times a week versus more. But there was one study that showed that more was better. So we don't know. We don't know if more is better. But if you do it once to twice a week, you should see the benefits from it, if there are. And you don't necessarily need to do it more than that, but you can if you want to. So what is it? The most common technique that's taught by OBs and midwives is kind of a general stretching technique. So they recommend that you do it for 5 to 10 minutes. A lot of midwives will recommend daily, but it looks like the evidence-based recommendation is more like two times a week. So you're going to use 1 to 2 fingers, and you're going to insert 1 to 2 centimeters into the vagina. Actually, one of the recommendations was 2 inches. So again, there's variability between how people teach this, but from what I read, what I saw online, it's typically up to 2 inches into the vaginal canal, and you're pressing towards the back, so towards the rectum, to stretch that tissue out. Potentially from 3 o'clock, if you think about the vagina as a clock, and 12 o'clock's at the urethra and 6 o'clock is at the anus, and then 3 o'clock and 9 o'clock are on the sides. You're kind of going from that 3 o'clock to 9 o'clock. So that back half of the vaginal opening along the perineal body and along the sides, that's where you're looking at stretching, and you want to do gentle to moderate pressure. You can press and hold. You can go straight to the back. You can go side to side, one at a time, both sides at a time. Again, there's variability in how this is taught. But that's kind of the most common technique that's taught. You want to use some kind of a natural based lubricant. So sweet almond oil, I saw, as a lot of the midwives recommend, but you can also use coconut oil, other types of natural oils. And I'm going to link in the comments. There's a wonderful website called Evidence-Based Birth that has a great article on the Cochrane Review from 2013. And then I'm also going to link, there a link to the Cochrane Review, so you guys can look at that if you like. And then this is a really great resource kind of on the technique that's from a resource in the UK, but it has a really nice diagram and description. So I'm going to link those in the comments for you guys as resources to kind of dig into this deeper if you want to look at more evidence. So what is the pelvic floor physical therapist's perspective? Is it really stretching the tissue? Are we really stretching out your perineum so a baby's head can fit through it? No, right? We don't really want to stretch your vaginal opening to the size of your baby's head prior to your baby pushing out. So what is it that we're trying to do? What are we trying to do with the tissues when we perform these techniques? And from the purely, labor prep standpoint, I would argue as a pelvic floor physical therapist, my goal when I teach this technique for labor prep is to increase your awareness of what's happening at your perineum. So to play with the sensation of stretch, for you to know and be aware and connected to that part of your body where you're feeling the stretch or going to feel the stretch during a vaginal delivery. And once you have good awareness of that area, then I want you to be able to relax it. So we want to train you to be familiar with the sensation of stretch, to not be afraid of it, and then to consciously relax into it, potentially to bear down, right? To push the baby out as you relax into it. So with perineal stretching, I'm really looking for, can you relax the muscles? Can you then put a stretch sensation through the muscles and still relax and still breathe, because that's going to benefit you in that second stage of labor when the baby's crowning and you're trying to push. So the ability to relax into stretch is more how I look at the benefit versus actually we're stretching out your tissues. Now there may be some benefit also in terms of like elasticity and mobility and like loading those tissues. We don't have any evidence for that. But that's kind of how I look at it as a pelvic PT. And because of that, it's going to be a lot more important for you and potentially beneficial for you to practice this technique prior to birth if you already have pelvic floor dysfunction. So pelvic floor dysfunction is not something that only affects postnatal people, okay? It affects a lot of people who have never had babies, including men, including all people. So if you have ever had in your life prior to being pregnant, urinary incontinence, pain with intercourse, pain or irritation with bowel movements, pain with bladder function, pain with a full bladder, feelings of incomplete emptying, anything that's not quite right around your sexual function or your bladder and bowel function, it's possible that you could already have some funky things going on with your pelvic floor. So it's even more important if you, for example, the last week we talked about non-relaxing pelvic floor dysfunction. If unbeknownst to you, you already have a pelvic floor that doesn't want to relax, that doesn't release well, and that doesn't stretch well, it's more important for you to get in and learn how to touch base with your pelvic floor and learn how to relax into the sensation of stretch than potentially for someone that doesn't have those issues. So I would encourage you, if you have had any signs or symptoms of pelvic floor dysfunction, like the things we mentioned, and you can especially go back and watch last week's video on non-relaxing pelvic floor dysfunction. If you have any of that going on prior to your pregnancy or during your pregnancy, you definitely want to see a pelvic floor physical therapist to really get an assessment of what's going on, and then B, talk to that person about perineal stretching, whether it would be beneficial for you and how to do it effectively so that you know you're really getting the most benefit from it. So that's really all I have to say about perineal stretching. This was a really short one today, which is kind of a nice change. And I don't think we have too many people viewing, but if you do have any questions, go ahead and put them into the comments there. And I'm happy to answer them. Again, I'll just recap everything that we just talked about. So with perineal stretching, the evidence is that there is some evidence-based benefit to first-time mothers with a vaginal birth. We see a reduced incidence of episiotomies, so potentially reduces your risk for episiotomy or for more significant tears and lacerations. It may also reduce your risk of pain further, like 3 months postpartum if you're a second-time mom. So those are the effects that the evidence shows with perineal stretching. From a pelvic floor therapist's perspective, we're not looking at it so much to actually elongate or stretch the tissues around the vagina. We want you to become more aware of your pelvic floor, what it feels like to stretch the tissues surrounding the vagina to prepare you for how it's going to feel when the baby's crowning, and then also to be able to relax those tissues effectively and not have an anxiety response associated with that sensation of stretch, be able to relax. If you have any signs or symptoms of pre-existing pelvic floor dysfunction, especially non-relaxing pelvic floor, so if you have any urinary incontinence, any pain with intercourse, any discomfort or pain with urination, frequent UTIs, pain with bowel movements, pelvic pain, deep glute pain, anything that might indicate you might have non-relaxing pelvic floor, and I'd refer you to our last Facebook Live to learn more about that, then it's even more important for you to potentially look into these techniques in the 4 to 5 weeks leading up to your delivery date, and certainly meet with a pelvic floor physical therapist who can help you navigate. Do you have a tight or irritable or non-relaxing pelvic floor? How do you stretch it effectively? How do you release it comfortably and safely in that last trimester of your pregnancy? So again, any questions, go ahead and stick them in the comments. Otherwise, please do let me know if you have anything you're interested in hearing about from a pelvic PT's perspective on our next week's Facebook Live. Thanks for joining me, and I will see you soon.